Hello, viewer. How are you doing? Apologies for the delay. It was a technical issue. I didn't know that I had muted my laptop, but I just realized later that I had muted it. So we are going to go live in the next 5 minutes. So kindly bear with us, even as more people join us. Thank you. Um, Evelyn, check WhatsApp. Check WhatsApp. Hello, viewer. We are going to start in the next few minutes, so do bear with us. In the meantime, kindly share with your networks so that they can also follow the live stream as we speak with the phenomenal African women from Kenya who are doing amazing work, reaching out to pregnant women in their communities in their different ways. So today we are going to have on board Evelyn Bowa, as well as Margaret. So tune in. We are going to start in the next few minutes. So kindly bear with us. Share with your respective networks so that they can also join in this important discussion that we are having this evening. Share with your networks this YouTube channel. If you have not yet subscribed to this YouTube channel, kindly go ahead and subscribe by clicking on the subscription button. Yeah, so all right. We are starting in the next few minutes. You're sharing this channel with the oh, thank you. Yes, we can see there are people who are logged in. This is so as a viewer who's watching us from various parts of the from all over Africa and globally. In this time of COVID-19, what are you doing? What have you started an initiative that is going to impact the lives of your community positively? All right. Oh, thank you. You can see Mother, she's saying she's locked. So she's so excited about the conversation. Nice to hear that. Yeah, so Mother, we are about to start in the next few minutes. And sorry for the delay. It was some technical issues. I had what I did is I had put the mute the mute I had muted my laptop. So I was wondering why the panelists can't hear me. So when I realized it was a bit late, but we are now okay. All right. All right. All right, I can see Suleiman Wanambisi is saying he's tuned in. All right, nice. Thank you for tuning in. It's a delight to have you on board, and thank you for journeying with us till this point. Yeah, so right now, yeah, yes. Exactly. All right. So I'm seeing Ambassador. Hi, Ambassador. Oh, Margaret. Hi. Hello, Margaret. I can't hear you. Maybe we'll work on her mic. All right. So, viewer, today we have phenomenal women who are doing tremendous work with regard now to combating COVID-19. And they have initiated projects in their community to aid pregnant women. So welcome on board. My name is Violet Mbiti, and I'm the convener of Real Talk Show, hosted by yours truly. So this particular channel, what it does is that it highlights the continent's most dazzling change makers who have great stories to tell about Africa. I hope you will join us as we showcase and celebrate African achievements. So the other thing I'd also like to mention is that I also chair the Working Group on Political Feminism, Women Empowerment, and Women Representation in African Democracy, and Diane, which is also headed by Frederick Ebert Stiftung Africa. So Jan brings together youth from Western Africa, Central Africa, Northern Africa, Southern African, and East Africa. So today we are joined by amazing women who are going to share what they are doing with regard now to curbing COVID-19 in their communities. So to start us off, we have Evelyn Oboa. Evelyn Boa.
Yes.
How are you?
I'm fine.
All right. So viewer, what I'm going to do is we're going to share a little bit about the profile of our viewer. So Evelyn Bower is the founder and executive director of Awoche. All right. So Awoche stands for Agape Woman and Child Empowerment Foundation, and she is also a maternal and reproductive health advocate and a motivational speaker. Currently, she is championing for maternal health of women during COVID-19. She is helping women to continue accessing health facilities and sharing toll-free line to be used during the curfew hours. She is also working on ending teenage pregnancy in Kibera. Kibera is one of the largest slums here in Kenya and also even in Eastern and Central Africa. Her awareness creation has helped in reducing the rate of teenage pregnancies in Kibera. So, in Kenya's largest slum, pregnant women fear restrictions imposed to fight the coronavirus. And these restrictions could prevent them from accessing the medical care they need when giving birth. So, what Evelyn Oboa did, she engaged the area MP and his wife, the sub-county reproductive health coordinator of Langata and Kibera and other stakeholders to ensure that the Kibera Health Center is functional. So as we are speaking, because of the effort of Evelyn and her team at Awoche, a driver has been hired to drive the Kibera ambulance, and it has been equipped so that it may facilitate pregnant women during delivery. And as we are speaking right now, the constituency first lady for Kibera has become a converted champion for maternal newborn health. And as a result of what Evelyn Bower and our Watcher Foundation did, the Nairobi Metropolitan, where also Kibera constituency or sub-county lies, also decided that it's also going to initiate a project called Wheels for Life. So this project aims to provide free Uber Bolt transport to pregnant women to the maternities during this curfew period. And the service is totally free. So congratulations, Evelyn, for initiating this. And because of your efforts, the Nairobi Metropolitan Service decided to also replicate the same. So all that the mother requires to do is call a toll-free number 1196, where the doctor on call will assess the case and call the Bolt for the pregnant woman who is either in labor or in an emergency-related pregnancy. All right. In addition, she has fashion and design skills, and with her skills, she has mobilized young women to access tailoring skills to earn income to support their babies. She has been able to train 50 young women with her skills, and they are currently earning income for self-reliant and self-sustainability. With the program, they are initiating supply of reusable sanitary towels to the community for a sustainable program. She is also producing masks for children to prevent the spread of COVID-19. She has been able to supply 400 masks in 2 phases. So remarkable. All right? So remarkable. Evelyn Bower serves as a vice chairperson in Kibera University College and Alumni Association, KUKSA, which brings students together with alumni to give back to the community and to serve the welfare of students. More than 50 ladies are key women in leadership through her mentorship. In her workplace, she has been able to help in achievement of different key success. Under her leadership, she has managed to visit the disadvantaged in the communities, among many more achievements. Ms. Bower holds a Bachelor of Arts degree in Community Development from Daystar University, and currently, at this period of COVID-19, in addition to distributing masks, all right, they are also distributing food to needy families, and they have reached 150 families so far. So, Evelyn,
Yes.
welcome to the live broadcast.
Thank you so much.
Is there anything else you'd like to add?
The journey of working with expectant women has been so amazing because number one, so many people were in fear. They didn't know what to do. They were just sitting in fear. And so discussing with them the toll-free line and just giving them hope to continue accessing quality medical care in health facilities has assisted so many of them to get quality medical care and to deliver safely in the medical hospitals. And as we all know, we are currently under curfew control, and cars are not working, and accessing transport is one of the main challenges. So it forced some women to go to our kungas in the community. So that is why we rose and decided to talk to women to discuss with them what they need to do. Apart from fear, they need to rise. The toll-free number 1196 is so accessible. It doesn't need any money. It speaks you and it helps in accessing health facility anytime, anywhere from 7 p.m. to 5 a.m. in the morning. And so for me, I would like to say that the journey is worthwhile, and the lives that we've saved are so many. So that is what I would like to share.
Wow. That is just that is just also and like how has the reception been down at in the community?
So many women are coming out to, number one, to know how can they access medical health facilities more so during curfew hours. And so many people are being recommended. We have so many people who are visiting the office anytime. People are calling our numbers just to be sure that they are safe. We've had calls even outside our region. And so for me, the reception has been so much welcoming. At some time, it was overwhelming because people were so much in fear and they thought that the government has left them behind. No one is taking care of them. And remember, they are so critical currently. And if the house is not taken care of, you remember the case of a woman who contracted COVID-19 and died, and the kid was rescued. So those are cases that we decided we need to rescue for people to have information, to how to protect themselves because they are not secure because of they're not desegregated because of their status. Yeah.
So I'd like to ask you like did you map out are you implementing the whole of Kibera, or is it the whole sub county, or is it in a particular ward? So what exactly where exactly are you implementing this initiative?
The initiative is being implemented in all the wards in Kibra. So we map out every
How many
ward,
wards
every
are there?
village to work. We have 5 wards. So we have Makina, Sarangombe, Lindi, Lainsaba, and Woodley. So we've been able to reach out to all the wards for the time that we've been doing this. So we map out a ward, we walk to the villages. So we don't do one ward completely. We do different wards during the week. We map out the villages and we walk. And the strategy is to walk door to door and to talk to women, expectant women, all of them. We work even in salons. Just if we find any woman, even along the road, we talk to them and give them the information. Because number one, uh, yes, the number Wheels for Life was launched, but not so many people are aware of it. So we decided to rise so that we can help people have access to the information.
All right, all right. So right now, there are some photos that I'd like to share, and you can explain the significance of each photo. So tell us about this particular photo.
So this is we are walking deep inside the villages to the unreached places. So we are targeting places where people are not being reached, not along the roads, deep down in the slum settlements. So this is our journey towards a certain home where we were told that so many expectant women are in that area. So we decided to walk down to that village. So
Ah,
that is the team
uh,
that we are working with. This
mhm.
is part of it. I'm behind there, and we are also ensuring that we are wearing masks and keeping social distance is a key aspect to protect ourselves because it is also we are not left behind. So we have to stay safe all the time, even as we save humanity.
Okay, kindly share with the viewer because you know, like there are also other viewers who are joining us from the rest of Africa. Kindly share with us about Kibra.
Okay, so Kibra happens to be the second largest slum in Africa in the world, and so currently, for people who have seen, we have cases of COVID-19, and some of our people have been quarantined. But in line with expectant women, uh, not so many. Not there's no woman who's pregnant who has been quarantined, and so for Kibra, keeping social distance is a problem. Some people cannot even afford the mask. Water, where you need to wash your hands frequently with soap and water, is also a main problem because we had water problems for the last 2 weeks. So it has been a main challenge for us, but we keep on discussing, encouraging people to continue ensuring that they stay safe all the time despite the challenges that we are facing. And so, for it is a slum settlement whereby we have informal houses that are mud, and on the top is mabati structures. Some of it are mabati structures.
Iron
So that
sheets.
is how, yes, iron sheets, exactly. So that is how Kibra is. But we are trying as much as possible to sensitize women, number one, to be indoors, not to walk all over, so that they could not contract the disease. And then number two, we are telling them to wear a mask anytime that they leave their houses. And then number three, they should ensure that anytime they leave the house, or someone, even if their spouses leave the house, when they're coming back to the house, they need to wash their hands, because you never know where someone have touched. So prevention is better than cure. And then we are also sharing with other women to share the information to other women whom we've not reached. And we are keeping the number. We are trying to come up with posters so that we can stick at doors in the different villages for people to access the number easily, and also to have the number whereby they can call anytime and have the information. And so the picture that is being shown on the screen is I was speaking to an expectant woman, and for her, she didn't have any information. She was 8 months pregnant, and currently she's given birth to a baby girl. Uh,
Oh, nice.
she didn't have any information, and in fact, for her her pain started at around 6 p.m. So when she called, I told her just to rush to the hospital, not to wait for curfew, not to wait until the pain persists. I just advised her to go to the hospital to seek medical care. Of course, we have 24 hours maternal health facilities in the area, but some are not functioning full time. So there are hospitals that recommend patients to visit, that are 24 hours, and they can be accessed anytime. Because we've had a case whereby a girl she was a teenage girl. She went to the hospital and she was sent to go back home, and she was in labor pain. She visited like three hospitals and she was being returned home, because you see what, people are in fear of what contracting the disease. Not all the health facilities around have the protective gear, the PPEs. So you find people are in fear of handling such kind of cases. So we give recommendations to different hospitals. Number one is Kenyatta, number two is Mbagathi, number three is Kibera South, number four is Langata Health Center. We have CDC. So we have a number of hospitals that are functioning 24 hours. And the best of all, that is a private, we call it Carolina for Kibera, that also assisted us in the case whereby that girl was sent in three hospitals after being refused to be taken care of. We referred her to Carolina and she got help. And finally, she delivered to a baby. So we thank God. The journey has been so tedious. It is engaging. Your phone can be ringing like even at night, and you have to respond to patients. So for me, it is a journey that is worth pursuing to save women, because negligence is no defense in anything. So just sharing the information that we have to people to safeguard their lives. And then the next photo that is on the screen, we are now working. In fact, when we were starting our journey with the expectant mothers, our objective was just to share information to save lives. But when we went deep down into houses, people are starving, because number one, the expectant women are casual laborers, and currently there are no jobs. People are not allowed to enter into homes. So you find a woman who has three kids, does not have a job, The husband is also a casual laborer, no job. So they'll tell you that they are just surviving with the grace of God. So we decided to source for friends who could help us to just provide food for the needy families. And we thank God for our MP. The wife came in support and provided for us with food, and we've been supporting the needy families. Anywhere we go, we get a needy family, we give them, we go back and we give them food. And of course, we don't tell them, we just take it as a love gift. And so many people's women have shed tears appreciating for the gift that we've given them, because some of them have been surviving in one meal throughout the day. And so for this, our first lady coming in through for us, it was a big thing for us, because number one, you cannot walk into someone's house and then you find her starving, then you leave her the same. So we decided to rise above our objective and meet another objective. And so the picture that is on the screen, that is the first lady. She's called Anne. And
First
then the
lady,
lady,
first lady, kindly elaborate on first lady.
or the first lady is the wife to our MP in Branokos. So we did home visits with her. So here we were delivering food. The one that is the lady wearing a black top is a teenage girl. She got pregnant when she was in Form 2. Her dad has been locked out of Nairobi when she was going for work. So she's staying with the brother, and they are struggling to survive. She's not working. And so for her, we have uh, decided to journey with her from the time she'll deliver the baby. And on all women that we've journeyed with, we decided to work with them until the babies are 5 years old. And so we are not just visiting them and then leaving them. So we are journeying with them. We want to ensure that the babies have taken vaccines, they are breastfeeding for 6 months, the babies are eating well, you don't want to have cases of malnutrition and all those things. So our plans are post-COVID and sustainable, just to have a healthy lifestyle. And for those, for example, the teen moms who have delivered, we've come up with a program. Apart from tailoring, he decided to increase in beauty, in catering, so that people who have different skills can learn. The next picture on the screen, that is a woman. She was almost giving birth. She was 9 months. She was counting weeks or days, years to deliver. And so we visited her. But the first time that we went, oh, it was so touching. She was just sitting. The babies are crying. The house is in a mess. No water, no nothing. And so for her, and you see her condition, she cannot work for herself. She needs someone to help her out. And so we decided to come. For then we carried a packed meal that was already cooked, and then we gave her to share with the family first, and then now we left. And of course, the journey has been tiresome, because number one, you walk into a family's house and then you find someone cannot be able to do house chores alone. So but sometimes be challenged to assist in one way or another. And then another thing, some women do not have telephone numbers. We've gone to a place whereby the woman has mental issues. She does not accept that she's pregnant. She tells you that she has pneumonia, but when you see her stomach, it is like 8 months old. So we've had different challenges. Another is when you go to a house, a teen girl is pregnant, she's facing frustrations, there is conflict between her and the family. You try talking, you give guidance and counseling. So in the midst of our journeys, we have been able to address different things that come in. And our volunteers came in good time. They've been supportive, and they are doing this just to save the community. Our volunteers consist of young women who are, let me say, who gave birth, who dropped out of schools because of pregnancy, and so they also decided to journey with other ladies for them to give birth and continue with education. So for me, what I'd like to share about COVID-19 and pregnant women, it is not an easy journey. It is a tiresome journey, and we want to call upon the government maybe to see a way whereby they can assist these expectant women. Number one, to have information all the time and to assure them that their health is taken care of despite the condition, the pandemic that we are going through. They need to encourage them to continue with the antenatal care clinics and post-antenatal, postnatal clinics all the time, so that their health is considered first. They should avoid fear. Yes.
Oh, awesome, awesome, awesome. Yeah, so like here are views from even the viewers who are joined in. Mother Kombe is saying, I'm locked. So excited about this conversation. All right. Suleiman Wanambisi is saying he's tuned in. Grace Mageka, she's watching us from Rome. All right, in
Ah,
Italy.
nice.
Do you have a question for her? If you have a question for her, you may also ask. And then there's also Lucy. Lucy, she's saying you are doing amazing work. Awoche. Sheila is joining us from Kilifi County. She's
Ah,
saying she's
okay.
glad to join in. And then we also have Habanas. Hesbonus Luke, he's saying great session. If measures are not put in place to save the life of pregnant women and unborn babies during this curfew, we may have cases of home delivery that might put into risk. So before you comment on it, let me add Margaret. Margaret is also joining us. Margaret, can you hear us? Hello, Ambassador Margaret, can you hear us? Can you hear us? Because I think I can. So in the meantime, as Ambassador Margaret works on her mic so that she can also share with us what she does at pregnant moms and pregnant and moms. Ambassador, can you hear us? Is she the one smiling laughing? All right, let me. What I'll do, I'll just call her so that I can tell her that we can't hear her. Yeah, because after Evelyn's presentation, we are going now to go ahead and also share about the remarkable work that Ambassador Margaret is also doing. All right, all right, Margaret. So Evelyn, what do you have anything to add?
Maybe what I can say is one thing that people need to know, that COVID-19 does not select anyone, and everyone needs to stay safe all the time and follow directions that have been given by their different government leaders. And then number two, if you find an expectant woman along the road and is not wearing mask, you need to tell her to put on their mask, because their life is at a threat. And then number three, they need to ensure that they stay home, avoid movements from one place to another. And then number four, they need to have emergency lines, numbers that would help them when they are having emergencies in the house.
All right.
Yes.
All right. So, viewer, so we've talked with Evelyn, and Evelyn has shared with us what she's doing in the community with regard to reaching out to pregnant women. But we also have on board Ambassador Margaret. So Ambassador Margaret, now once a lady is pregnant, now that is the time now she comes in and gives advices now to even online lessons on pregnancy for expectant mothers. So if Ambassador Margaret, can you hear me? Evelyn, kindly don't leave the kindly don't leave the broadcast. So what we're also going to do right now. Hi Ambassador, can you hear me? Ambassador, can you hear me? Okay. While Ambassador is working on her mic, I'd like to share her profile. So her name is Margaret Mushu, founder of Pregnant and Mom. All right. So Pregnant and Mom is a grassroots organization based in Nairobi, Kenya, that has been conducting small focused conferences and get-togethers for pregnant women and new mothers. So Pregnant and Mom has been conducting monthly conferences or get-together since December 2018 for moms and pregnant women, and inviting professionals to speak on different topics that cover the pregnancy journey, delivery, breastfeeding, and baby care. The get-togethers are currently being held in Nairobi and Nakuru towns here in Kenya. In addition to the get-togethers, Pregnant and Mom recently launched a monthly magazine from January 2020 that is meant to reach a wider audience of pregnant women and moms who are near and far but are not able to attend the get-together in person. In response to COVID-19, they are adjusting their strategy to be offering pregnancy classes online to help prepare expectant women with information and educate them on different aspects like diet, exercise, and etc. So let me bring on board Ambassador. Ambassador, can you hear me now? Ambassador.
Yes, I know you, Violet.
All right. So right now, I'd like to share some photos. I'd like you to illustrate what each photo means.
In Nairobi, and I can see should bring a thing on that photo.
Margaret, you are breaking off. You are breaking off, Margaret.
Can you hear me now?
Yes. Continue.
I see that photo. You can see. We are one of the day in Nairobi. We usually meet on back Apostle Barui at the so that's one that bring down. Yeah, especially
Ambassador Margaret, we can't hear you. It's breaking off. I don't know why. Is there another like? Eh? Can you hear? Can you hear us? Huh?
yeah.
Pardon? Okay,
I can hear you, but
okay. Kindly elaborate on the photo then.
yeah. Can you hear me?
Yes, yes.
Example, you can see that.
Okay. So Ambassador Margaret, we can't hear you clearly. So what I'll do is just go through the photos and so that the viewer now can be able to understand. So viewer, the photo on your screen, you can see women, pregnant women and moms have come together and they are receiving various kinds of training, and that's a huge number that is there. So pregnant and moms, you're doing an amazing work. So the other photo, this one is it's a pull up from the magazine, which is called P and M. Pardon?
Yes. Put it on magazine. Every issue.
Pregnant and moms. All right. Yeah. So Margaret, it seems like we can't hear you. So what I'll do is just illustrate the photos that you shared, so that now the viewers can can understand. No, you are breaking off. It could be the internet connection. Eh?
Yes.
All right. So this is a copy of their magazine. Okay. This is a copy of their magazine, P&M, and they are showcasing one of the events in one of the towns that they have visited, and you can see that at the moment what they are doing, they are offering pregnancy classes online, and the benefits are you will have a smooth pregnancy, you will learn good breastfeeding, you have a support group that will support you, and they also offer exercises to prepare you for labor, and whatever they are doing will help reduce postpartum depression. So if you'd like to get in touch with them, you can do so, and they charge 1,500 shillings for you to receive the pregnancy classes online. So 1,500 shillings is like $15, and by so doing, they will be able to serve you better. So Evelyn,
Yes.
you have had for yourself. You have had for yourself what pregnant and mom are doing, offering pregnancy classes online. So, what do you have to say after listening to their presentation?
Their presentation is nice. For me, I don't know their target group. That is why they're
Pregnant
doing
women,
well.
pregnant moms.
Yes, pregnant moms, like from where you see, like for ours are pregnant moms in the slum settlements. So for us, most of the women, you see, even if they don't have a phone, we are not in a position to develop online. That is why we're going to them through door to door. And then we have a review strategy for every month or twice a week. We communicate back to them to know what they're doing, the challenges they're facing. So we have organized them into 10 people per group per area so that they can coordinate with one another. Where there's a problem, they call us. So in the 10 to 10, we are expecting themselves to teach each other, to grow each other, than us handling everything. So we are trying to also mentor them, to mentor other people in the area of pregnancy and development. And so also one thing that I've lacked, they've mentioned, is also the issue of PPD, postpartum depression. Of course, it is affecting so many women, most so the first babies, first pregnancy. So it is one thing that also we can be done in a good way for all mothers. And then also the issue of the magazine is very nice. So I like their work and they're doing an amazing work. Maybe we can reach out and partner together in maybe during COVID and after COVID.
Ah, wow.
Yeah.
Now you can at least viewer, now you can see even there is a opportunity for collaboration. Um yeah, so as she has shared, as Evelyn has shared, you see, like now in the slums, the probability of offering online classes is a bit tricky. So what they do is they offer door-to-door training, and it's also amazing that Ambassador Margaret and her team at Pregnant and Moms, they are reaching out now to women now who have access to internet and offering online classes. So there you can see that even with regard to the geographic location, you
Mm,
have to adjust your strategy accordingly.
mm,
Right?
yes.
And yes, so I just want to congratulate pregnant and moms for the amazing work they are doing, the pregnancy on classes which are online. Wow, that is so remarkable. I also want to congratulate you, Evelyn Bower, and your team for the remarkable work you're also doing in Kibra. Uh, this is just brilliant. So I want to say thank you to both of you for gracing this particular platform and sharing your story. And we celebrate you today, and we thank you for showcasing your story and the remarkable impact that you're having on the community. Ambassador, can you hear us now? Are you able to speak? I think there is an issue with her technical, with her audio. So, what are your last words, Evelyn, as we end the
My
broadcast?
last words. Uh, each woman stands for herself. She stands up for all women. And that is why we decided to rise up to ensure that we rise to support other women, woman for woman. And I would like to congratulate all women that are in the journey of pregnancy up to till 9 months. And I pray that they'll give birth safely, but they need to take care, they need to stay safe. And then also, we need to support them emotionally, we need to support them physically. When they need some help, let's rise and support the expectant women. And then lastly, the work that you're doing is such an amazing work, and we need support from different people. We need volunteers to join us so that we may reach other settlements within Nairobi and even outside the county of Nairobi. And so we call upon anyone who's willing to support us, who's willing to join the team. They need to feel most welcome to be part of us to save expectant women. Of course, our work is even after COVID and continuous. It's not just at the beginning and the end, it's a continuous work from now henceforth. Thank you so much. And thank you for hosting us and encouraging other people to. For those who've joined the show, we are so grateful. And Thank you so much.
All right. Thank you. I appreciate it. And thank you, viewer, for watching this live broadcast. Thank you for taking your time. And if you've not yet subscribed to this channel, kindly go ahead and subscribe, and also share the link with your friends and also with your network, so that they can get to learn more about what was discussed today. So thank you, Ambassador Margaret, and thank you, Evelyn Boa, for
Thank
joining
you,
us and
Violet.
gracing this occasion. Yeah. So on Wednesday, viewer, we are going to host Petrida Paul. She serves as African Union Youth Advisory Council Board member. So she has her message for African youths. So kindly join us on Wednesday at 9 p.m. And yeah, so we just want to say thank you to God for the open doors, for the open networks, and even for the remarkable guests that we usually host every week on this particular channel. So thank you,
Violet.
and God
So
bless.
I'd like to, before you end, people can follow our work on all social media platforms. We are on Instagram, we are on Facebook, Twitter, and also our YouTube channel. So even our website is up and running, so people can share,
What is your
contact
handle?
us.
What is your social media handle?
For Facebook, it's Agape Woman and Child Empowerment Foundation. If you search Awoche, you'll find. Twitter, it's Awoche Girls. Instagram, Awoche Foundation. YouTube, Awoche Foundation.
All right.
Yeah.
And viewer, because Ambassador Margaret, she can't reach us on audio. What you can do is you can go Google, and you can type pregnant and moms. All right. So let me share with you their website link. Yeah, it's kind of like it's not opening, but you just go and Google pregnant and moms, and say pregnant and moms Kenya.
Pregnant mom.
Yes, Ambassador.
Mom. MOM.
Or pregnant and moms, MOM.
Pregnant and mom.
Oh. Okay.
Pregnant and mom.
Or pregnant and mom. Yeah. So let me write here pregnant and mom. So on social media handles, just go and type pregnant and moms, even on Twitter, and you're going to get them, and you can go and interact further with them and also give them business. And if you're a donor who's watching us, if you'd like to donate to Evelyn Boa, Awoche Foundation, kindly do so. Yeah, and if you're a donor and you'd like to donate to pregnant and mom, kindly do so that they can reach more people effectively. So thank you, viewer, and see you on Wednesday.
Thank you. Bye.